Hello everyone, this is Dr. Anjali Kumar once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So for today, we've chosen a very important topic. We will be talking about sexually transmitted diseases. They are known as STDs, STIs or venereal diseases, VDs. Millions of women and men across the whole globe suffer silently because there's lack of awareness, lack of knowledge about the prevention and treatment about the STDs. It is still considered a topic which is hush-hush, which is a taboo topic. Not many people speak openly about it, but it's high time that we speak about it. We speak about it openly. So what is a sexually transmitted disease? It's an infection which is transmitted from one person to another person through a sexual contact, whether vaginal, anal or oral. It can be caused either by a bacteria or a virus or a parasite. STDs can affect both men and women, but in today's video we will be talking about the STDs in women, but the information broadly applies to men also. STDs in rare cases can also be transmitted from one person to another person by some rare means, like sharing of needles, like during breastfeeding, and even from mother to baby. So what are the symptoms of sexually transmitted disease? Number one is that a woman can be having ulcers, sores, blisters, some kind of bumps or growths around the vaginal opening, around the anus, on the buttocks or on the vulva. She could be having dirty vaginal discharge, which could be greenish, reddish, yellowish, curdy white. It could be foul smelly. It could be having a fishy odor. Then there are some delayed serious effects of having a STD too. A woman could be having a chronic pelvic pain, which means all the time she is suffering from pain in the lower abdomen. She could be having blockages in the fallopian tubes, which can cause infertility, which means that there is difficulty in conceiving a baby. In case the pregnancy occurs, there's a possibility that the pregnancy can happen even in the tube, which is known as ectopic pregnancy. In case a mother gets pregnant, then there could be chances of miscarriages and preterm labors and small babies. Also, there is a possibility that the mother may actually transmit this infection from herself to the baby also. One very important point. Some people with STDs may not actually have any symptoms. Now, this means that the person is a carrier of infection, but she is absolutely capable of transmitting the infection to the other person. So remember, absence of symptoms does not mean absence of infection. Now let's talk about how do STDs get transmitted from one person to another person. Number one, obviously through a penetrative, vaginal, anal or oral sexual activity. Secondly, through a physical genital skin contact. Now remember, penetration is not necessary. Ejaculation is not necessary. Still, STDs can be transferred merely by a skin-to-skin contact. Third, through a genital or oral contact with the eyes. They can also cause eye infections. And number four, from the infected mother to the baby. There are few more facts which you should be aware of. The infection might actually appear weeks after the original sexual contact. Having one STD puts you at risk of acquiring the second one also. A weakened immunity also increases the risk of acquiring STD. Smoking also increases the risk of acquiring STDs. Hugging someone, sharing clothes, sharing glasses, sharing utensils, sharing a toilet does not transfer the STD. So then let's talk about what are the types of STDs. Please remember, the information which I am talking about is purely for awareness and education. Please don't try to make a self-diagnosis by just listening to this video. It's very, very important to visit your gynecologist in case you're suffering from any symptoms like that. The first one is gonorrhea. It's caused by a bacteria and it causes dirty, yellowish, greenish discharge and painful urination. The second one is the chlamydia infection. This is also caused by a bacteria. This also causes dirty vaginal discharge, painful urinary symptoms, sometimes sores and infected glands. Then the third one is a trichomonal infection. It is also called trich. It is caused by a protozoan and it causes a very dirty, fishy odor into the vaginal secretions. Another important STD is syphilis. It's a serious disease. It is caused by a bacteria called Treponema pallidum. In the beginning, there could be just a small blister which is called chancre. It's painless but a very, very infectious blister. Then there is herpes infection which is caused by a virus called the HSV. It can be of two types, HSV1 and HSV2. HSV1 causes oral herpes and HSV2 causes the genital herpes. Herpes causes very painful blisters and it's a very, very contagious disease. Then even genital warts or the HPV infection is a sexually acquired disease. The most dreaded STD obviously is the HIV infection. HIV stands for Human Immunodeficiency Virus. It's a virus which attacks the immune system of the body, making the person more prone to infections and also making them more prone to certain cancers. Unfortunately, HIV has got no cure. But nowadays, with early diagnosis and early treatment with antiviral drugs, most of these patients can actually lead a normal life and can decrease their risk of transmitting the infection to another person. Then there are certain uncommon types of STDs also, like chancroid, molluscum, LGV, pubic lice, scabies. Certain STDs can be treated completely, like chlamydia, gonorrhea, trichomonas, while there are certain STDs which cannot be unfortunately completely treated, like herpes infection, HIV infection and HPV infection. Then let's talk about the most important part of this video, how to prevent STDs. Number one, most important. Use a condom. Use it the right way. Use it each time. Remember, condom gives you a protection against STDs which are spread by the body fluids. Condom still does not give you protection against skin-to-skin contact from the infected area from one person to another person. Avoid having sex with multiple sexual partners. Avoid having sex with a partner who is already infected. Always remember, STDs may be asymptomatic, which means that you must ask your partner about his or her infection history. In case the partner is infected, insist on getting a proper treatment done. Do not have sex till the time the partner is completely treated. It is a good idea to wash your hands before and after the sexual activity. It is a good idea to pass urine before and after the sexual activity. Avoid douching the vagina because douching the vagina can cause micro cuts or abrasions inside the vagina, which makes a person more prone towards acquiring the infection. Make sure that you do not smoke. Your immunity is good. Make sure that you take the appropriate vaccinations like the hepatitis vaccination or the HPV vaccination. It's a good idea to talk to your doctor about the pre-exposure prophylaxis in case your partner is HIV positive. Very important, avoid sexual activity when under the influence of drugs or alcohol. Make sure that your immunity is good, your hemoglobin is good. Make sure that your sugars are under control. And remember, the birth control methods like birth control pills and IUCD do not offer you protection against sexually transmitted diseases. Few strict don'ts. Never self-diagnose or self-treat or take a treatment from Dr. Google. Never take antibiotics on your own. If you've been advised to take antibiotics, please take the course completely. Never use any creams on your own, especially steroid creams, especially on infections like viral infections or warts, because these creams can exaggerate these infections. A small bit about the home remedies. Internet is full of home remedies for the sexually transmitted diseases like apple cider vinegar, garlic, echinacea plant. But remember, taking these home remedies may ease out your symptoms, but they do not offer the complete cure. So make sure to get your infection diagnosed well and treat it completely. So I understand many of you probably would have got a little scared after listening to this video. But it is very, very important to be aware about this important information. STDs are serious, contagious infections with probable long-term implications. They need to be diagnosed well, they need to be treated well by qualified medical professionals. So stay aware, stay safe, stay healthy. And if you like this information, please do not forget to like, share and subscribe to Maitri. And I will see you soon.